My name is Elisa Hunter, and my daughter Kora is 18, and she has been dealing with POTS for on a severe level for about 2 to 3 years, and prior to that, intermittently for probably another 2 or 3 years. Kora's most problematic symptoms included passing out regularly and severe fatigue, and I'm not talking like she was just really tired. She could not function. The brain fog was so severe that it really affected her every aspect of her life. Between the dizziness, her blood pressure would drop, her heart rate would accelerate, and social anxiety it kept her home constantly. She could barely go to school, let alone actually function as a teenage girl. Our cardiologist from Cook's Medical Center, Cook's Children's Hospital, actually referred us because she got so severe that how the cardiologist was treating her, even though it's not a cardiologic problem, they were using medication to kind of keep her blood volume up. And it worked for the first 6 months, and then after that it just quit working. And so he spoke with a rheumatologist at Cook's who had heard that you guys were seeing really amazing outcomes in your patients, and so they referred us here. When we first started the POTS program, we were very hopeful. We didn't know what to expect. I mean, I knew that it was going to be the training of having her parasympathetic nervous system kind of counteract what her sympathetic nervous system was doing. But other than that, we weren't exactly sure how that was going to happen. I started noticing a difference in Kora's symptoms by the end of the 3rd day. And it wasn't drastic. It was just because I know Kora and I know her well. And she was smiling, and she popped up out of bed at one point in time, which does not happen. And by the 4th day, she was asking to go shopping, to go try on prom dresses, and do things that she hasn't been able to do for a long time. So I got very excited about that. And by the end of that day, kind of overdone it, and she had a little bit of a setback, and she wasn't feeling the greatest according to her, and I could tell she didn't feel well. But her not feeling well on that day wasn't anywhere near what her not feeling well the 2 weeks prior would have been. And so there was a drastic difference even by the end of the first week. I mean, she had bad days like normal, but she had more energy throughout the day. She was showering and getting out of bed and watching movies and going out in public, and her social anxiety actually waned so much. At this point, she has a lot more energy in the mornings. She is getting tired, but not to the point of exhaustion. The dizziness is gone. She hasn't fainted once in 2 weeks. Her heart rate, her everything is she's able to control all of that, and it's made such a dramatic difference in everything, actually. Not one doctor to this point has addressed Kora as a whole, and because she does have a connective tissue disorder that is linked to her developing POTS, there isn't going to be a way to put a Band-Aid on it, to just treat the symptoms and it go away. And Dr. Capriano was the only doctor up to this point that I had heard say anything about Kora maintaining a homeostatic balance. And she addressed things that I've spoken to other doctors about, that I've pleaded and begged for them to help me find the right solution. But they weren't able to, because it's just a lack of, I don't know, I think just busyness, and they deal with what they deal with. But I know that within this treatment center, they looked at Kora as a whole and not as just one area that they needed to address. It addressed everything overall. Dr. Capriana is, she's unique in that she understands that what she's doing is unheard of, basically, here in the States. She understands what these kids deal with, even we've met so many adults that have dealt with POTS when we were here, that have dealt with it for years. And she's the first doctor that truly understood when Kora said, "I'm exhausted," that she truly meant, "I can't get out of bed during the days." That Dr. Capriana understood that Kora had given up her entire high school career, her entire quality of life because of this disease. And she understood that Kora wasn't being dramatic. Kora didn't want to feel like this, that Kora wants to get better. And not every doctor we've had, but many have kind of addressed the situation in a, this is what your life is, you're gonna have to learn to deal with it. And as a mom, that's not good enough. And so I would say, if you're considering this treatment, I've gotten my little girl back, and I would have done anything to see that happen. And there were times I didn't know if it would. And so the 2 weeks that we've spent here and everything that Kora has learned, that has changed how she feels and how she looks. I mean, you can see the difference. It's worth everything. So I'd say do it, because you will get something out. You're going to get out of it what you put into it, but at the same time, it's scientifically sound and it worked. And that's all I care about.